Hello, my name is Shavonna Rose. I am a paramedic with Cumberland County EMS, and I have been with them for 7 years. I'm also a training officer there, so I do train as well as remediate. I am an instructor with Fayetteville Technical Community College, and I have been teaching here for 5 years at the degree program. I actually enjoy teaching and instructing. It's something that I do take great pride in, and I believe that today our goal for the completion of the course is going to be appropriately and competently completing a surgical cric. So if you guys can bear with me through my death by PowerPoint, hopefully it'll be exciting for you. But we're going to go ahead and jump into it. So we have surgical cric by myself, Shavonna Rose. We're going to start off with what is cricothyrotomy, right? So it's a big fancy word, and it's kind of like when you look at it, what is it? So basically it is an emergency airway intervention that can be performed by ALS providers, and paramedics are one of those, which you guys are learning to be, paramedics. So with this particular structure right here, it is showing you the cricothyrotomy, some of the airway structures. You have your thyroid, your cricothyroid, your hyoid bones, and your membrane. So this is important because you want to know where you're actually placing that scalpel when you're making that puncture. Does anybody have any questions so far?
No, ma'am.
Okay. So there's different kinds of techniques. I know this is a little small, so if you have any questions or if you need to step up, just let me know. But you do have the surgical technique, which is using a scalpel, and tracheostomy, which we do have here. And after the completion of the program, of the presentation, we're going to go over some of those things, and I'm going to show you all how to do that hands-on. And then afterwards, you guys will get your practice. There is the needle portion. That can be a little tricky, but that's something that we see in various different services. And then we have the percutaneous as well. But we'll get a little bit more into this. I don't want to go too fast to confuse anyone. We have what the definition of cricothyrotomy is. It's defined as the surgical placement of a hole in the cricothyroid membrane, at which point an ET tube that is cuffed is placed into the trachea to provide ventilations. So as where normally a patient would be intubated, they would be receiving oxygen through the BVM through their mouth. However, this would be placed in their trachea. Is everybody still with me?
Yes, ma'am.
Okay. Why is cricothyrotomy important in the pre-hospital setting? Well, for us in the field, and you'll get to see this when you go on some of your clinical rides and even when you get into your services, some of you may have already seen it, but it's for airway management that is critical, as it is viewed as a life threat. If not managed appropriately, the patient outcome can result in, what do you think?
Death.
What do you know? It's death.
Look at me go.
So yes, if a patient's airway is not managed appropriately, which that is your job, we've kind of gone over some of that in some of our previous lessons, our ABC, so you want to make sure that airway is controlled, and that is that's your particular forte, if you will. That's up to you to make sure you control the airway. So manage that appropriately, and if you have to aggressively, and this is a very aggressive form of airway management. However, in some cases, it may be the only option. As a paramedic, it is important to know not only how to correctly perform this skill, but when it is necessary to perform it as well. So we're going to kind of get into some different cases in which this would actually be appropriate versus when it wouldn't be so appropriate. So you guys get to have a little fun coming up here shortly. Cricothyrotomy is an invasive procedure and should be used as a last resort for attempts to secure an airway. So just as I spoke on briefly, we have our BVM, so you have positive pressure ventilations, we have CPAP, we have other forms that might kind of help a person breathe, but if a person absolutely needs this, then that means that their airway is imminent, and it's probably an obstruction of some sort. But like I said, we'll have a little fun, we'll get into it. So, this is what we were just talking about. When is a cricothyrotomy indicated? Cricothyrotomy should be performed when a patient is unable to be ventilated, intubated, and death is imminent if the airway is not secure. So like I said, that is you guys' feng shui, as I'll say, and that's your MO. That's your MO. That's what you're supposed to be doing, is managing their airway. Okay. So. Gotta love technology. All right, so here's some examples. We got some examples. Anaphylaxis. I know it's not a pretty picture, but that I've actually seen some that have been that bad or actually even worse. Anaphylaxis is one of the more severe ones. Even though there are others, anaphylaxis is a really severe case when that might be the only way. Like right now, this lady, I doubt you can put a BBM on her or a non-rebreather, nasal cannula. She's probably wanting you to cut her trach. Yeah. And so here's a more in-depth view of how anaphylaxis can cause an airway obstruction, making the airway difficult to effectively ventilate or intubate. So if you notice here, the tongue is so swollen that it impedes the airway. So it makes it virtually impossible for any airflow to move in or out of that area, which is obviously going to be imminent for the patient if they have some issues getting oxygen to and from the mouth to the esophagus, trachea area. So we're going to probably make an incision there and try to save their lives. Is everybody still with me? Does anybody have any questions so far?
No, man, we're doing good.
Anybody bored to death yet?
Not yet, not yet.
Okay, what about this one? Significant facial trauma.
No landmarks.
No landmarks. You have no way to possibly intubate this person, ventilate this person. I mean, he's probably still alive in this picture. However, he's not able to breathe functionally. And this gentleman either. So, an airway obstruction, teeth in the mouth, go down the throat, dentures, things of that nature would actually impede the airway. So this is one of our situations where cricothyrotomy or cric is going to be appropriate. Okay? What about foreign body upper airway obstructions? What about foreign body? So we think about people that choke on foods, objects. Unfortunately, kids put marbles and everything in their mouth. So there's things that can impede the airway physically, not just things like their tongue. So, excuse me, foreign body airway obstructions can be items such as food. Steak is common, as well as vegetable matter. Toys or coins are common in airway obstructions in small children. These things can cause the airway to become impeded, making ventilation or intubation difficult or impossible. What about burns?
Oh, that's a good one.
Burns are a really good one. So if you think about, and again, like I said, we were getting into the anatomy. So you have your bronchi, you have your stems, and then you have all of this good stuff up here. So if you think about a burn, the first place that a person inhales something is their nose and their mouth. So if they're inhaling soot or anything that's going to cause their airway to inflame, guess what? That's going to be something that's going to go really quick. So we're talking about people that are in house fires, maybe car fires, and now we've got so much edema and inflammation, we got to cric them. So these are some good patients that cricothyrotomy would be indicated as well. Burns can cause the airway to become compromised as a result of inhalation injuries. This can cause the tongue to become swollen, as well as the epiglottis, creating a difficult intubation or ineffective ventilation. A patient could benefit from a cric in this case. So, like I just said, you have patients that may not be candidates for intubation because there's so much swelling and inflammation in that area. So, the next step, unfortunately, would be a cric. Okay. So, what do we need to perform a cricothyrotomy? First, we need PPE. We want to make sure we have gloves and our mask. If you wear eyeglasses, that's fine, but you want to try to make sure you have some eye pro if you can get to it. Just remember that that's the number one thing that's important in the field that we should put on prior to patient contact in any type of call we go to. It's extremely important when we're performing a cric because you're dealing with blood and bodily fluids. This procedure can get kind of messy, so a couple of towels being around probably wouldn't hurt. Excuse Excuse me, this pollen is wow. I know you guys like my little animations. I enjoyed making this stuff. The kit. So I've got this out for you all, and we'll see a little bit later on, shortly here. So you have your airway, which is a little bit shorter than your regular airway because of where you're placing that. Then you have your instruments, your bougie, and what you're going to use to apply that. You have your scalpel, and then you also have your syringe. So this is all what comes in the kit, and I've went ahead and opened that for you. So this is everything that comes in it. And like I said, we'll open that up and do the ooh, ah, put our hands on the thing kind of here shortly. You also need your BVM, your oxygen, and your end tidal. If you don't have your BVM, then you're doing all this for nothing. If you definitely don't have oxygen, then you're definitely doing all this for nothing. However, your end tidal, the reason why that's important is because it's going to help you measure placement, as well as it's going to help you measure if they're getting ventilations effectively, all right? So, steps to take in performing a successful cricothyrotomy. First, we want to ensure that we have all of our equipment out and ready for use, as shown in previous slides, as well as I've just shown you. We're also going to make sure all of our equipment is working appropriately. There's nothing like getting in the field on a call and none of your stuff works, especially when you're in a particular situation where you're already in a high stress level. Secondly, we want to correctly locate and identify our landmarks. Next to proper preparation and careful planning, identification of the landmarks is key in performing a successful cric. Last